Back now on Triad Today, and we want you to meet the real Patrick Duffy. Now, everybody's getting excited. Says, "Is this the man from Dallas?" This is the physical therapist, and we're just as glad to meet him. And Patrick, how you doing?
Very well, thank you.
Good to see you, Patrick. Of course, physical therapist, and let me tell you where you can see him at High Point Orthopaedic Physical Therapy. That's a Cornerstone practice, and what a great profession that you're involved in. I know from experience with family members, just a great profession, and thank you for all you do.
Thank you.
How would you define a physical therapist? I mean, I've never asked that question because it sounds kind of dumb, I know, but just answer it for me anyway. How would you define it in terms of what you do?
Physical therapy is kind of like the mechanic of the body. We try to take sort of the pieces of the body and put them back together from a working standpoint. If something is out of place, we try to help the patient or help the person figure out what movements, what exercises. Sometimes when you're the patient, it's hard to know what to do. Should you stretch it? Should you rest it, for example?
And you can do the wrong stuff if you try to do it on your own, too. And that happens a lot, right?
Right.
People say, well, I've got this. I've been in the hospital a couple weeks rehab, and I'll just take it, the rest of it. And they really need to follow up, in a lot of cases, with somebody like you, because they can, re-injure themselves. What kind of education and licensure are needed to become a physical therapist, in case somebody maybe is looking ahead or a young person thinking of a career?
In the state of North Carolina, as it is in most states, you have to have a license to practice. And in order to be eligible for license, you have to graduate from an accredited college in physical therapy. Most programs now are a doctoral program where it takes 4 years undergrad and then three years of postgraduate school.
Lord, that's a lot of time put in.
It is.
But to hone that profession, but I understand why it's needed. Can people who are watching, they say, I might need some physical therapy. Can they just, at the end of the segment, we'll put up a Cornerstone website. Suppose they go to that or they call your office. Do they just walk in and say, "Hi, I'm John Doe, I need some physical therapy," or do they always have to be referred by a doctor?
Good question. In the state of North Carolina, you can legally see a physical therapist without a referral. However, most cases we see patients after they've been referred by their doctor. Kind of like you go to your doctor, you may get a prescription for medication, you would get a prescription for physical therapy in the same manner. They would write an order for therapy, come to or call our office, or whichever physical therapy office which is convenient for you, and we would make an appointment and see you that way.
Are there any different specialty areas within the physical therapy arena?
And that's one of the neat things about physical therapy as far as getting into the career itself. There's really a wide range. You can work with kids in a pediatric setting, either in a hospital or in a school setting, work with students in school or at home. You can work in orthopedics, kind of a sports medicine type setting with high school athletes or college athletes or even professional athletes. You can also do home health physical therapy, geriatric physical therapy. A
lot of ways to go.
So that's.
What are the most common injuries that you help people rehab from?
In the clinic where we are, we're an outpatient orthopedic sports medicine clinic. We do see sports medicine, but probably the biggest thing we see is just average everyday people, and kind of from the ages of, say, the average is about from 25 to 65. A lot of bad knees, bad shoulders, people who've had shoulder surgery, try to prevent shoulder surgery or knee surgery after total joints and things like that.
How's your practice changing as baby boomers, I'm pointing at myself, get older?
We've seen, in fact, probably one of the bigger things we've seen lately is a lot of either total shoulder surgeries, rotator cuff surgeries, or total joint replacements. Either patients after they've had surgery, or in fact, hopefully patients ahead of time trying to prevent that, to kekeep them active. People as they get older.
And they have been active, boomers by large.
Yes.
Not me, I've been remiss at this, but most of us my age that are in the 60 range have been active, and then they sort of maybe overdo it or whatever, and that puts them in your ballpark. What advice, before time runs out, what advice do you give to your patients who are new to all this?
Patients coming into physical therapy, I guess one of the pieces of advice I give is kind of what my father, kind of the advice he arrived at as he was a patient in a physical therapy clinic was the bad thing about physical therapy is you have to do it to make it work.
There's no shortcuts.
There's no shortcuts. Some people think physical therapy, I like to say this before my patients say it, physical therapy stands for pain and torture, the PT. Now, there's a little truth to that, but you get a good physical therapist who can help you figure out what type of exercise you should do.
And work with your mind and emotion and get you revved up to do it. There's a lot of, next time you come, we'll have to talk about the whole emotional things. I think you guys have to be psychologists too, in a way. www.cornerstonehealth.com is lots of information about that, and you can get in contact with Patrick at High Point Orthopaedic Physical Therapy in High Point. Thank you, sir.
Thank you very much.
Will you come back sometime?
I will do.
All right. We'll be right back after this.